I love working with kids. I spent several years as a social worker working with adults, and now I get to work with kids, and it's a lot more fun. I get to, sit with them, play games or play Legos and just talk and be on their level. I have a lot of students that I work with for many different reasons, for grief and loss, for maybe social anxiety. Having someone that the students can come to that is a safe place for them, someone that's going to take that time. Like, my sole job is to listen to them and to understand them and help them deal with issues that they're going through. It is huge, it's essential. I mean, they need that in order to then go back to their classroom and thrive.
When you showed me the data a week ago and the number of students that our Youth First social worker has worked with, the number of families, the number of teachers, I knew there was a need, but it just blew my mind away. And I'm nothing but pleased. And if I was a school that did not have a social worker, I would be looking to get contacted with Youth First.
The needs of our kiddos and our families are they're very great. It was a need that had to be met. And we're just privileged to have Youth First to help us meet that need.
I'm providing them hopefully with courage to branch out and develop those coping skills that are healthy, that are going to promote wellness for them in the future.
My mom, I was actually talking to her, and she realized that I was kind of struggling, and I'd always usually done a pretty good job of taking care of it, but I was just in a place where I needed someone to talk to.
In my own family history, when there's not a healthy coping mechanism, you find those unhealthy coping mechanisms. And that's always been one of my greatest fears for my children, is that, they turn to substance abuse instead of somebody to talk to, instead of a relationship. So I reached out to Ashley and asked her if she would be willing to meet with Avery and, help her with processing some of those feelings that she was having and that social dynamic with her peers.
Well, I think teens they either don't think at all or they think things too much and they overthink a lot. So that's the hardest part, because either you don't think and you make a mistake, or you overthink and you make a mistake, and it's just really hard to put everything in perspective and figure things out.
She's in junior high. She also struggles with just maybe a little bit of depression or sadness, anxiety, which is very typical for a lot of students in junior high. We also work on just building her confidence, because she's a very smart and capable young lady, and she has a lot of good qualities going on for her.
It went really well. It really helped me. I felt like it was very easy to talk to her, and I really felt like someone was listening for once.
I think the biggest change that I've seen in her is a healthier peer relationship. I've seen a lot healthier home dynamics where she feels like she can express herself, I think, more clearly. She's not afraid to ask for help. And that's what I love about it, is that she knows that this is not something that's wrong with her. This is not something to be ashamed of, that she has to advocate for her mental needs, because life is hard, and it's harder now, I think, on our young people than it ever has been, because of the social media aspect that they're always exposed to. And, you take COVID and you take all of the added stressors of that. And she's just really learned some healthy ways to cope with it and express her needs.
I'm very open about it. All my friends really know that, yeah, I have some issues and that I need help. But, I never saw it as, I feel like society sees it as, a thing that's, bad. But, really, I feel like everybody really does need someone to talk to. And I just think it's just a normal thing.